After a month on the vaccine non grata list for over 55s, the AstraZeneca jab is now back on the menu in Belgium. The country's health council reversing its recommendation that the shot not be used in people over 55, citing new, large-scale studies out of the UK showing strong efficacy in older age groups.
Vaccination with a dose of Pfizer or a dose of AstraZeneca has been associated with a significant reduction in symptomatic cases of COVID-19 in the elderly, along with better protection against serious illness.
The reversal comes amid a vaccine shortfall, which has dampened Belgium's immunization efforts. Vaccine centers like this one in Brussels have been injecting at half capacity for weeks, while the vast majority of the country's 300,000 AstraZeneca doses sit untouched in refrigerators. Officials hope this reversal can kickstart inoculations. After weeks of negative headlines, some in Belgium have turned down the jab, but many say they don't care what vaccine they get as long as they get one.
I'm 65 and I feel that I'm on the more vulnerable side, so any vaccine I think would be fine for me.
I trust that if they're qualified, I think they're good to go, yes.
We have to trust our governments, our health authorities. They are probably, I believe that they are doing the best for us.
Experts say Belgium needs to be tactical in its approach, focusing on the most vulnerable.
You could cut your mortality rate by 95% with 2 million doses. That's the reality. That's how these numbers work. And I know that health authorities aren't actually saying this to people, but that's the reality.
Once the elderly population is protected, government officials say lockdown measures can be lifted at a much quicker pace.
Besides the reversal on the AstraZeneca jab, health experts also said that when necessary, the gap between the first and second dose of the Pfizer vaccine can be widened, a strategy that has proven effective in the UK. The change gives the government options to get immunizations back on track.